Welcome to the presentation, The Innovator's Prescription, a disruptive solution for healthcare. The healthcare system in the United States has been facing many challenges, and most of the pressing issues are related to cost. In order to gain control of a healthcare cost, a major transformation of how care is delivered has to occur. Christensen, Grossman, and One proposed disruption of the different components of healthcare as a continuous improvement concept. The disruptive innovation theory explains the process by which complicated, expensive products or services are transformed into simple, affordable ones. Christensen et al. Argue that only disruptive innovation can transform the U.S. healthcare system to significantly improve access and cost. Within this framework, we will discuss three continuous improvement concepts that are at the core of healthcare disruption process. These concepts are disruptive business model innovations, disruptive technology enablers, and disruptive value networks. Concept number one, disruptive business model innovation. Business model innovation is the creation of interdependent systems of value propositions, resources, processes, and profit formulas. Business models can be defined in three different forms. Solution shops that address unstructured problems, value-added process businesses that transform resources into goods and services of greater value by standardization of processes and equipment, and facilitated network businesses, which are multiple business interacting with one another through business transactions. A disruption business model occurs when one model is displaced or eliminated by another business model. The business models that must be disrupted to significantly impact cost in healthcare are the disruption of hospital business model. Today's business models are a combination of solution shops and value-added processes, which requires that two types of business models are simultaneously being conducted. Another disruption that has to occur is the disruption of the physician's practice model, which is already occurring in healthcare in three different forms. First, the alternative healthcare providers such as physician's assistants and nurse practitioners are disrupting the work of the physician's medical practice by handling cases that can be diagnosed with precision. Second, the chronically ill patients who require constant care are being treated by managed care networks who are disrupting physicians' medical practice for the ongoing chronic illness management. The third type is the specialist physicians' work, which is being disrupted by the primary care physicians when they treat situations with diagnosis and treatment of illnesses managed through intuitive medicine. There is still going to be a need for a specialty physicians, but they will be handling more complex cases and uncommon illnesses. The third type of disruption that needs to occur is the disruption of the reimbursement system. Currently, reimbursement is categorized as fee-for-service and capitation. Fee-for-service is when the physician charges one specific fee for each service that they provide. And capitation is when a health maintenance organization or HMO receives a fixed fee for each person they treat. The first one benefits from keeping the patients ill because they provide more services and charge for each one. And the second one benefits from keeping the costs low, which presents a situation, a problem, when they don't refer patients to the specialists because that would mean less reimbursement for the gatekeeper. Another form of fixed fee model is the accountable care organizations, which are claimed by many reformers to be disruptive of the current reimbursement systems. However, Lofvenson argues that it is difficult to think of ACOs as different enough to overcome the challenges that HMOs faced when they were first introduced. This series of disruptions require the collaboration of all stakeholders, which will be extremely difficult to accomplish because of the personal interest of every party. However, if we look at healthcare organizations as gigantic, complicated conversations, as described by Suchman, Slaughter, and Williamson, we will notice that some of the sub-conversations have already started to take place. Throughout the nations, we find mergers, absorption, and creation of mutually beneficial partnerships. Some argue that while final prices may be influenced by the collective bargaining power of mergers, Gannon argues that these mergers have proven to be unable to reduce costs, for which it may be wise to welcome competition among products rather than negotiating more fruitless mergers. The traditional management theory looks at organizations as machines, in which each group of workers carries out their own assigned tasks. However, that concept creates a false sense of control. Applying the theory of self-determination, healthcare workers need to feel appreciated, supported, involved in the change process, and be provided opportunity to develop competence, and the machine analogy inhibits self-determination. Collaboration and building partnerships are core competencies for the successful implementation of process improvement initiatives, according to Walters and Purdy. Healthcare professionals taking the lead to disrupt the existing business model will need to demonstrate these competencies to create and foster an environment where disruption can fall. The second concept that we want to discuss is disruptive technology enablers. Disruptive technology refers to the way inputs are combined and transformed to add value to the outputs. Disruptive technology is defined as the transformation of complex processes that require highly skilled experts into simpler, standard work that can be performed by less expensive technicians. Technology enablers are the technological and scientific innovations that transform medicine from intuitive into empirical and then into precision medicine. One case of disruptive technological enabler is the advance of medical device and diagnostic equipment industry, which has created a revolution in healthcare. Decentralization makes goods and services more accessible. So the disruption of the MDDE industry has to be decentralized so that innovation becomes available in smaller points of care, such as clinics and even patients' homes. Another disruptive technological enabler is the pharmaceutical industry, which undergoes disruptions constantly. While many argue that drugs are major contributors to the rising cost of care, others argue that even as expensive as they may be, medications are cheaper than the alternative form of treatment. Disruption of the pharmaceutical companies is introduced by pharmaceutical companies themselves, as opposed to other industries. The pharmaceutical companies have been outsourcing many of their functions, and these newcomers that are providing these outsourced services are going to be the disruptors, are going to become the competition for the pharmaceutical companies before they realize it. These newcomers will be disrupting the industry. Whether major pharmaceutical companies lead this transition or become victims depends on their leaders' ability to navigate through the transition process of disruption, according to Christensen et al. The pharmaceutical industry needs leaders who can demonstrate initiative, sound judgment, strategic implementation, and situational awareness. These competencies are crucial for their company's survival. They have to be able to think and apply strategic concepts and make decisions based on awareness of their environment. A third form of technological enabler is the medical education. American medical graduates are regarded as highly trained and motivated, but they spend about 10 to 18 years in training, and in addition to exorbitant debts when they graduate without the certainty of return on investment once they start practicing. Training medical professionals is also expensive for the American people, as taxes are sent to fund medical education. The American medical education system will inevitably face major disruption. Three forms of disruptions are required: the need to improve the existing training model to afford students more hands-on practice, the new alternative medical professions such as nurse practitioners and physician's assistants, and then foreign medical schools and major health systems are training their own doctors because they are trying to fill in the gaps in knowledge that they experience in the graduating classes. Despite all the gaps and flaws of the U.S. medical system, education system, it has a widespread reputation of high quality. Through this process of disruption, it is wise that changes are promoted from within the environment, from within the education system. Analyzing the change process from the perspective of the alternative inquiry methodology, leaders in the medical education would benefit from integrating the positive aspects of the current education system. Appreciative inquiry looks at the root cause analysis of the success instead of the flaws. And Rotherham, Burroughs, Swedenman, and Chopida proposed utilizing the model of disruptive innovation to re-engineer evidence-based intervention, focusing on their most robust features to serve more people in less time at a lower cost, which can be applied to the education system when we look at the appreciative inquiry theory. The third concept that we want to discuss is value networks. Value networks are the context or ecosystems in which businesses operate and interact with one another to provide goods and services to common consumers. Similar businesses allow value networks to practically determine what takes place. In other words, value networks are so powerful and influential that they can block or give way to disruption based on how it fits their business models. Integration of a disruptive value network is more likely to succeed when orchestrated by a major corporation or group of corporations that can include different business models and profit formulas, such as accountable care organizations, which are usually characterized as disruptive innovations. Another candidate that would successfully integrate new value network would be integrated fixed fee providers who are large enough to establish their own insurance payment plan, employ their own team of physicians, etc. A third integrator would be the major employers, who would be ideal because they benefit from keeping employees healthy and productive. The infrastructure created by these major employers not only will benefit them, but also the small employers that cannot create one on their own. All this disruption and orchestration is a major undertaking. One example of that is the Carnegie Mellon University and the insurance provider Highmark, who joined venture to develop innovations to reduce cost. They may be among the first large and powerful organizations to seek the creation of value network. In conclusion, the task of decreasing costs in healthcare requires the involvement of every stakeholder. Disruption of the healthcare systems will also require regulatory changes by the government in three different aspects that they influence the industry: by subsidizing the industry's foundation, stabilizing and strengthening the companies involved, and encouraging competition to reduce prices. Once the big picture is clear, leaders must define what the outcome is that they seek, identify the stakeholders and partners that would help them achieve those outcomes, and define the plan of action that needs to be taken in order to achieve those goals. Thank you.